I'm Dr. Ahmedov, hair transplant surgeon from Smile Hair Clinic, Istanbul, Turkey. Today, I would like to share with you a different case. Most of the time when we have the series video, it's the outcomes of the hair transplantation surgery. It's predominantly the type of the surgeries we do. But there can also be different types of the surgery. Most commonly, it's for men, of course, beard and mustache transplant, and for females, but also the same thing for the man, we also may have an eyebrow transplantation surgeries as well. So today we are going to share with you the results of the patient who underwent a beard transplantation surgery in our clinics almost 14 months ago. This is the 33-year-old white male. So the main reason he applied to our clinic that he had some frame of the beard, but the main issue was he was lacking the density, especially across the sideburns, cheek portion of the beard, and around the goatee shapes. So there was a frame, but it was lacking its volume and density. So the purpose of the surgery was the improving overall density across the facial part of the beard and make the transition across the jawline to the under the jaw areas. So essentially, you can see the picture of the patient here just before the surgery. You can see the frame or the shape of the beard is here, but he is lacking some density across especially the cheek portions. The transition or connection of the cheek portion of the beard to the goatee area and a lower part of the jawline is missing as well. So the plan was to keep his own frame of the beard and reinforce it as much as possible. The area was calculated. We estimated that he will need the number around the gulf of 3,500 up to 3,800 grafts to meet his basic expectations. So the frame was rebuilt, the shape was drawn, the patient consent was acquired. We extract from this patient 3,700 grafts. Out of this number, 1,250 were implanted on the left side of the face, 1,250 grafts were implanted on the right side of the face, including the sideburns, and there was around like 1,200 grafts implanted in the goatee area and under the jawline, because we need to make the transition in the area where this beard makes a transition into the neck portion of the face as well, so it gives the continuous look of the beard. And the patient went through the procedure. The procedure on average for the beard transplantation surgery, it takes slightly longer than compared to the hair transplantation surgery, because the facial part has its own different aspects we pay attention to. As mentioned earlier, we kept own shape of the beard but improved overall look of it, so it looks much more natural and mature. And here you can see the result of our patient, as mentioned, exactly 1 year later. You can see that the general frame of the face is reinforced. The beard looks very natural. It doesn't look something fake that was stuck in there. It fits, but it has never belonged this place. The transition from the facial part of the cheek portion to the neck portion is in a good condition. We linked up the cheek portion of the beard towards the goatee part, so this combination goes smooth and there's a whole picture. It's a kind of puzzle work. So, and the overall density is in good condition. The transitions are good. The direction of the grafts are in good condition. So it's very important, especially when we are doing the beard transplantation surgeries. We always tend to follow up the direction of the pre-existing direction of the beard the patient has. If no, there are specific techniques that give us specific direction and angle. And especially one of the key features for the beard transplantation or facial transplantation is the angle. When we do the incisions, the angle is almost parallel to the skin, so the hair should go in slightly downward direction. It cannot be directed downward, but it should be under the low angle. So you have to pay attention to this one, so the results look natural when the outcomes come to the view. So here you can see the final outcome of the surgery. The cheek portion of the face on the right and the left side look very natural. The transition from the sideburns to the facial part is smooth. The direction and angle of the hair is in good condition. The goatee part has regained its density and outlook, and overall look is very smooth and natural. That's how a life-changing simple surgeries can give you a boost in a self-confidence. The patient is happy, we are happy. That's once again a good result. So the patient is happy, we are happy. It's a successful result. That's the best gift for us as a medical team and the doctors, when the patient is satisfied with the outcomes of the surgery he or she have. So If you want to get more information about the outcomes or the possibility of the beer transplantation surgery, feel free to contact us or leave the comments underneath the video. We'll be glad to answer your questions and guide you to this process. Thanks for watching and stay tuned.